Right now, the world is suffering from the second wave of COVID-19. And what if Fiji suffers from the second wave? Do you have plans to try and help Year 13 students?
Sorry, just say that again.
So, what if Fiji suffers from the second wave? Do you have plans to try and help Year 13 students?
I think the most important thing is, firstly, the health measures come into is our primary concern. Saving of lives is very, very important. And we have, unfortunately, one death so far. This is a gentleman who returned from overseas. He had some major surgery done. And as you know, when you have COVID-19, you become a lot more vulnerable if you have, any type of, pre-existing illness or any surgery, etc. But if there were, God forbid, if there was some kind of community outbreak, the primary, focus would be to ensure everybody's health. That would be the main focus. So when you say to help students, that would be part of the focus to make sure the young people don't get it. And I think, look, I can safely say this, the only certain thing about COVID-19 is the uncertainty. The only certain thing about it is the uncertainty. We really don't know. So we actually sometimes people speculate, as you know, there's a lot of speculation in the media before when it broke out. But we are sort of taking some proactive steps. So for example, Fiji at the moment is chairing the Small States Forum at the World Bank. We've made our position clear. We're trying to get all the other smaller countries in the world to rally behind it. And to say that once a vaccine comes out, the vaccine should not be treated as a commoditized item. In other words, it should not be sold to the highest bidder. It should be treated as a public good. In other words, it should be a public good that should be distributed throughout the world. Can you imagine if the vaccine comes out and only the rich countries can access it? Only certain countries can access it. They'll be fine, the economies will take off. And if they say, okay, let's, on the other hand, it can be treated the other way. They say, oh, Fiji is great. They don't have any community outbreak, let's not give them vaccine. You just wait. But of course, if they do that, and it takes another 2 years for the vaccine to come to Fiji, we won't get any tourists. Because what if Thailand gets the vaccine? All the Australian Kiwi tourists will go there because they said, hey, everybody's vaccinated, we vaccinated, they're vaccinated. It's right to go there. So that's some of the things that behind the scenes that we are looking at and talking about. To be able to get access to those kind of medical inroads that they'll make regarding this virus.